And happy 2023. Welcome to our webinar. A few things before we jump into our presentation, just to let you know, a copy of the presentation is available for the download on the Files pod to the lower left of your screen. There's also a Q&A pod where you can write questions if you have. We'll usually answer those at the end of the presentation and as time permits. And CME certificates will be emailed to you in about 10 business days after the presentation today. So today we will be discussing considerations when departing from or closing a medical practice. Your hosts today are Kathy Bryant, who is the manager of TMLT Cyber Consulting Services, and I'm Cassie Turner, manager of TMLT Risk Management. And just as a disclosure to let you all know that Kathy and I do not have any financial relationships with ineligible companies to disclose for this course, which is eligible for 1 hour medical ethics and or professional responsibility. Again, your CME certificates will be mailed to you in about 10 business days. There will be a link that will populate at the end of the presentation where you can go in and do your eval. If for some reason that does not populate on your screen, you will receive an email that will have the link for the CME eval included and you can complete it there. So our objectives for today are to explain TMB rules regarding closing or departing from a medical practice, discuss how to best notify your patients when closing or departing from a medical practice, and review the requirements for medical records when closing or departing from a medical practice. And so, why is this important? I think that based on the attendance and the interest in this topic, we felt like it would be helpful. In our risk management department, we do get quite a few calls and consultations regarding leaving a practice or closing a practice. And this study here recently came out, I believe last year, October 2022, stating that 1 in 5 physicians say it's likely they will leave their current practice within 2 years. So again, just made us feel as though this is a good topic given this statistic is so striking here. So Kathy, I will let you begin to walk us through some of the TMB requirements.
Thanks, Cassie. Not unlike so many other things that regulate our medical or your medical practices, the TMB does have fairly extensive rules for retiring or closing your medical practice. Listed here are the topics that we will be covering more in depth as we go through the presentation. They are ensuring that patients receive reasonable notification, ensuring that patients are given an opportunity to obtain copies of their records or arrange for transfer of their medical records to another physician, notifying the TMB themselves when you are terminating a practice or relocating and will no longer be available to your patients. Uh, you must specify who is going to be the custodian of your records, and you must advise how copies of those medical records may be obtained. So, we're going to do a little deeper dive into these rules as we go through. One thing I'll mention uh, the downloads, the second download, the TMB rules are the current rules that are in place, and we made that available to you for easy reference. If much time goes by and you haven't referred to those, you might want to go to their website because those rules do change periodically. So, what are the patient notification requirements? There are 3 patient notification requirements. And as you will see in just a few minutes, it's not an option of 1, 2, or 3, but you must do something in each of the 3 categories. So the first category is a public notification that your practice is closing or you're leaving the practice. That can be accomplished in one of two ways. It can be put on your practice website if if you have a website. I recently had a question from a physician. Did they need to actually um, look at developing a website that they didn't have just to post that they were closing their practice? Um, and that's not a requirement, because the option is that you can actually put a public notice in the newspaper of greatest circulation in each county in which the physician practices. So if you're a physician in the Austin area, but let's say you have a practice in San Marcos as well, then you would need to place two notices if you were using the newspaper notification. So that's number one, the public notice. Number two is the notice must be placed in an obvious point or placement in your office. And number three, it's the individual notification for the patients who have been seen in the last 2 years. This can be either done by a notice in a letter form that you physically mail to your last known address of your patient, or if you have obtained permission and if state and federal law allow, you can send it by email. So again, it's not a pick one, two, or three. It's do something in each of the categories. So I think I've sort of already answered this question, but are all three methods of patient notification required? And the answer is yes. You have to do the public, the in-office, and the direct to the patient notifications. Are physicians required to notify all patients? The answer is no. You only have to notify the patients that you have seen in the last 2 years before you discontinue your practice. There are some exceptions, and we've got a slide on the exceptions that we'll cover in just a little bit. But that basically, if you have seen a patient anytime in the previous 2 years, they do need to be notified that you're leaving. So here are the exceptions to the patient notification. First, if you have been practicing as a locum tenens position, you are not required to give notice if you're discontinuing that part of your employment. If you're working in a hospital setting, an emergency room, a birthing center, an ambulatory surgery center, those are not required as well. And the last category are physicians who practice anesthesia, radiology services, or pathology services. They are all excluded from the notification requirement.
So, who is responsible for notification when a physician leaves a group practice? We get this question often in our risk management department, and it is the responsibility of the departing physician who is leaving from the group. So, we have heard of scenarios where the group says that they will handle it for the departing physician, and that could work very well, but at the end of the day, the personal duty in the eyes of the Texas Medical Board will fall to the departing physician. So if you are working with your group practice administrator as your department, you'll want to be pretty involved to make sure that all of those rules that Kathy has been outlining are being met. Otherwise, there could be a potential review from the TMB if those rules are not being met. So again, it's the physician's responsibility to make sure that those requirements are being met. So office requirement should be placed in the physician's office in a conspicuous location or in the facade of the physician's office as a sign announcing any termination, sale, or relocation. I did see a question about relocating. So, yes, this applies to relocation. The sign shall be placed there for at least 30 days prior to termination, sale, or relocation of the practice. And that signage should stay there until the date of termination or relocation of the practice. So Texas has addressed prohibition against any interference with patient notification. Again, this is in the context typically of a group practice. Other licensed physicians remaining in the practice may not prevent the departing physician from posting the sign, and they may not withhold information from a departing physician that is necessary for patient notification. So ideally, the group or the practice would provide the departing physician with contact information of their patients to ensure that the departing physician can fulfill their responsibilities according to the Texas Medical Board. Again, the board has rules prohibiting the practice or any remaining physicians in the group from interfering with patient notification. We have gotten questions where this does happen, so we just wanted to include this uh, about the prohibition as far as interference is concerned. So, is the departing physician required to find a replacement physician? The answer is no, you're not required to do that. Generally, it's going to ultimately be the patient's decision. I will just make mention that you would want to, if you're signing any contracts, make sure to review if there are any kind of clause in there regarding how those patients will be handled if you are to depart from the practice. And can the practice share the departing physician's new practice address? So currently, there's no requirement or regulation that requires the group practice to give the address or information of the departing physician when they are relocating. However, having said that, physician ethics requires that if the patient does ask the group must inform them of the departing physician's new physical address. And there is a white paper on this of the TMA Board of Counselors Ethics opinion. That's where this information comes from. So you're not required to, but if they ask, then you will want to provide that information for them. As with notification to the patient, you're also required to send notification to the TMB when you retire, terminate employment, or leave the medical practice. The physician, is responsible for notifying the board for relocating. Um, and also, like we mentioned to the patients, you'll also want to specify who has the custodianship of your records and how medical records can be obtained. The copy of posted notices shall be submitted within 30 days from the date of determination, sale, or relocation. You will submit all of that to the board. And there is a form that they have available to help with the submission of this information. And we have also included that PDF in the download file box to the bottom left that you can download and review and use if you're going to be moving, closing, leaving a practice. So that resource is there for you as well.
So, how are you going to assure that your patients have access to their medical records? We'll just start by reminding you that at the federal level, the Office for Civil Rights, or the HIPAA Police, as my favorite nickname is for them, they have really been stressing the patient's right to get a copy of their records. And I think this is a potential place that a patient, if they don't get a copy of their records when they request them, certainly could be uh, thinking about notifying the OCR and open or complaining that you did not provide the record. So keep that one in mind. You have to ensure that the patients are given an opportunity to obtain their records. In Texas, you have 15 days, 15 business days to provide those medical records, and they have to be in the form and format that the patient requests. You can't just give them automatically a piece of paper. You or their records on paper. You do sometimes uh, you do sometimes have to do them electronically or whatever the patient requests. You have to advise how copies of their medical records may be obtained. Again, this is all in those notifications that we covered in the beginning. And copies of the patient's medical records may be forwarded to the departing physician's new practice upon the request of the patient. So if you are just simply relocating to another location, uh, not within that same clinic, the patients can request that their records be sent to you. When it comes to the management of medical records when closing a practice, there are basically three things to keep in mind. Custodianship. Who is going to be responsible for keeping those records in a secure manner that they are then also going to be responsible for responding to requests for those medical records. Remember that the storage of the records needs to be secure, um, not perhaps just in a file cabinet in your garage if it was patient or paper records. If they're electronic records, it's a little easier. There are many options of where you're going to store electronic copies. But you also have to be able to retrieve them in a timely manner, whether it's you being the custodian or whether you hire someone to be that custodian. And again, don't forget the Texas Medical Board's on the retention of records. Generally, it's 7 years after the last date of treatment or contact with the patient. Um, Generally, we recommend if it's an OB patient to keep those records available for 21 years. And for minors, the rule is to maintain the records until the patient is 21 years old or 7 years after their last treatment or contact, whichever is longer. And don't forget, for deceased patients, those same time frames apply. So, Cassie, who owns medical records? I think the real key is that you need to make sure who is going to own the records at the onset of employment and make sure that's documented in your contract. There are a couple of really good resources that we have listed here, the Texas Medical Board rules, but also the TMA has a great publication on who owns medical records on their website.
Great. Thank you, Kathy, for answering that question for me. So other notification considerations, obviously you want to notify your malpractice provider, your underwriter, any employee notification, your business associates that you have will want to be notified, other vendors that you're working with, DA notification and drug inventory would be something to think about, Medicare, Medicaid, and insurance companies as well. Couple to think about if you're renting space, discussing with your landlord or any facilities managers and folks like that as well, as you're beginning your process to either leave, relocate, etc. And as you're preparing some just documentation considerations, again, we get this question or how to handle these things in our risk management department. If there are encounter notes that are not completed, making an effort to ensure that those are completed for the patients that you've been seeing, and then developing a plan and working with your group if you're leaving a group for outstanding diagnostic results and making sure that those do not fall through the cracks in any way. And then if you're working in a hospital or other facility, ensuring that those encounter notes are also completed and finished out before you are moving forward to a new location or a new practice. Finally, as we've kind of mentioned, there are another couple considerations are non-compete clauses that may be part of your contract as you're leaving or moving on to a new place or location, making sure that those non-compete clauses are considered. And then there may be times when you do need to seek legal counsel, particularly if there's something contractually that is challenging or difficult. Then we would definitely recommend that you seek legal counsel for any of those types of questions. Particularly around contracts is generally where this can get a little bit tricky, and the legal counsel is helpful.
Thanks, Cassie. We have quite a few questions that have come up. We would encourage you to keep asking questions if we have not already covered a topic that is of interest to you. The first one is from a physician who is going to be retiring soon, but is going to be keeping their license. They're asking that when they write prescriptions, the pharmacy often asks for my practice location. What do I use, my home address or my old practice location? Thoughts on that, Cassie?
So I'm not 100% certain, so we would want to look into this a little bit more closely. I do know that for the DEA requirements that they require it be a professional location. So I'm thinking it would depend on how you have things set up or if you're doing any telemedicine. It also would depend on what types of prescriptions you're writing, if there are any Schedule twos being done. But I do know that the DEA says professional address. So um, that's my first thought there is your professional address.
So that's a really good point with the telemedicine as well, is that their professional address may be their home address if they're doing that service from their home.
Correct.
Let's see. There was one kind of question, and I think it related back to the patient notification about what is reasonable. And really, reasonable is if you have made a good faith effort. Be like if you mailed letters of the notification to your patients, if you got a number of those returned, you've made a good faith effort to send it to the last known address. If there's not a forwarding address on file, you don't have a whole lot of control. You don't have to go out and try to track down the patients. If a practice has a Facebook or Twitter account, will that count as information via media if not on a website?
To my knowledge, no, that would not. That's not listed in what the TMB rules require. So I think I would follow the places where they're asking you to make your notification. Um, Also, with the thought that Facebook and Twitter, not every patient probably has an account. So again, following what the specific places that the TMB is put out.
I think we've already answered that the rules that we've gone over, and the notification requirements are not just for closing a practice, but they do apply if you're simply requesting, or if you're simply changing your address or office location. Can direct to patient notification happen via email?
I would generally say, as with Facebook and Twitter, to follow how the TMB has asked. Um, Email, and Kathy, you can and add on to this. Email would generally be need to be requested by the patient in order to comply with HIPAA rules and regulations. So I think my recommendation would be to avoid via email unless for some reason the patient specifically requests. And Kathy, feel free to elaborate.
And I agree. The patient really needs to request or have agreed to receive notifications by email prior to you sending them a notice. You will probably have um, a, a subset of patients. You may end up having to send some that you don't have email addresses. You may have to send those as physical letters while you send others as email. Then you get the whole question of, if you get a bounce back email, do you need to then send them a physical letter? Um, I think there are just some gray areas. A couple of years ago, the question of emailing patients was actually added to the rules. So just be cautious that if you are using email, that you make sure you have permission to use email, and also that that if you don't have email addresses on everyone, you use the physical paper letter. What if a physician within the group retires, but the patient may continue to be seen by the remaining providers? I think it's should, or can the physician or the patients continue to see other providers?
Sure. I mean, if that's what they prefer, they can certainly continue to be seen by any of the providers within the group. If they do ask, as we mentioned, where their current provider is going to share that information, and if they would prefer to move, assuming it's within their same area, to that provider, then sharing those records as appropriate and giving that information. But again, it's the patient's choice if they'd like to remain.
Um, what is the issue if you fail to take these steps?
So generally, the biggest thing would be a TMV review, Texas Medical Board review. I have seen sometimes there are fines involved with not meeting the requirements. So as best you can, make your best effort to complete the steps that they're asking of you.
The departing physician patient list only requires names and physical addresses. Is that correct? Um, I don't believe that the board specifies exactly what must be provided by the practice on that list. Um, I would hope that there would be something like a date of birth on that list, because common names, you would need another identifier to help you out there. So I don't think there's a requirement, but from a risk management standpoint, having not only the name, address, but that third identifier are, would be helpful. If a physician leaves the current employer and starts with a new employer 6 months later, does the physician have a legal right to receive a patient list from the previous employer to notify the patients of the new practice employment?
My understanding, Kathy, is that there is not a requirement for sending this information again, unless the patient asks for it specifically, can be given to the patient. And all of the notification requirements would be done 30 days prior. So 6 months later, I'm thinking there's probably not an obligation unless it's something that was in the contract that you had at the outset of employment. Um, but again, it would be that group or the practice, their primary responsibility is to provide you with what is needed for the notification portion, which is at the outset of the 30 days. So I'm thinking 6 months later, I don't know that there would be any obligation outside of that.
And I guess a different take on that would be if a physician was leaving a practice and got the list of patients from their previous employment, they haven't seen anybody in those 6 months. So that list that they got for the notification should still be a valid list. I don't know that there's a legal right to receive another patient list after 6 months, but that would be something that, if there's an issue, you might have to involve an attorney to get some assistance there. Do all these rules apply to physician assistants and nurse practitioners?
Currently, the rules, and Kathy, correct me if I'm wrong, only address physicians at this time. Um, There are no rules specifically for PAs or nurse practitioners that I'm aware of under the
That,
TMB rules.
right, that's my understanding as well. If you inform patients when they are in the office that you're closing the practice on a certain date and document that notification, do you still need to send written notice to that patient? I believe you do. There's nothing in the rules that says you can verbally notify the patient. What is your opinion, Cassie?
Yeah, I would agree. I would say, again, all three forms of notification need to be met, so that would still need to take place as far as the written notification to the patient.
I suppose if you're trying to, um, maybe save on some mailing costs, you could have the letter printed out and
Hmm.
track, who all you gave that to in that 30 or whatever period of time. Um, but then you would have to make sure that all the rest of the patients received the mailing or email. Do these rules apply if a physician leaving is an employee of the group, or only if the physician is a partner in the group?
I think it applies to both scenarios. The departing physician, whether they're an employee or a partner, would still need to follow these TMB rules.
If you close your office, but then go on to just do locum tenens, do you still need to notify the TMB?
Yes, if you're closing the practice, the TMB will need to be notified of the closure, for sure.
I know that we have had situations where the TMB actually gets note or gets calls or requests from patients who can't find physicians who have closed their practices. And so that's the reason that they require you notify them directly. Um, Physician says they started sending records to new doctors, and the doctors retired before the patient could get in for an appointment. Um, Sounds like an interesting situation. I think you still have an obligation to send them to whoever the patient requests if they could not get into the first patient or first physician, then you would need to make sure you get them or to the physician that the patient does ultimately see if you're requested to do so. Can a physician or office require a fee for the last copy of the medical record to the patient?
So yes, they can. However, Kathy, again, feel free to chime in on this one with your HIPAA background. We would recommend that you provide those for free unless you have policies and procedures that explain your fees for medical records. If it's not free, then the recommendation from the Office of Civil Rights, who Kathy mentioned earlier, is $6.50 for the copy in the form and format that the patient requests, as long as it's reasonable. So, um, again, I think our recommendation, Kathy, is if you can give it to them for free, or the 650 is what would be most acceptable.
I would agree with that. For the notification to the TMB, is it 30 days prior to the closure of the practice or within 30 days after the practice closes?
So the notification to the TMB would be 30 days prior to the termination sale or relocation of the practice.
Let's see. Um, I only have paper charts. Do we have to be able to provide an electronic copy if they request it that way? From a HIPAA standpoint, you do, if you can do it in and it's reasonable. So if you're going to make a paper copy, most copiers these days have a scanning feature. So to scan it and then provide it electronically would probably be a way to do that. I think it's always better to try to provide it in the form the patient requests, just to keep things from getting complicated and them filing a complaint with the OCR. Can you be custodian of your own records? Certainly, you can be. Um, that is certainly something that you know you can be custodian of your own records, as long as you're maintaining them in a safe manner and responding to the request for records. That's perfectly allowable. Physician asks, I have been employed by a health system and I have no control over my records once I leave. There are no other physicians in my specialty employed by the system. Is there anything I should do to protect myself?
Interesting question. I think it would depend on if you're within the health system, what your specialty is, and if you fall into one of the exceptions for notification. If you do not fall into one of the exceptions, then it may be worth checking with an attorney to see if there's something specific that you should be looking at with regards to these guidelines.
Is there a required length of time after the provider's last day treating patients that the website posting should remain up? Do
So
you?
yeah, well, at 30 days is prior to and until that termination or sell is complete, then it needs to remain at least the 30 days prior to. But as far as after, I
Right.
mean, after the 30 days is up and the departing physician has moved on, then that does not need to remain up on a website that I'm aware of.
And that's how I read the rule as well. Do you have to keep your business phone number active for 7 years after closing your practice?
I am not aware that that is a rule or a requirement.
Yeah, I think that that's part of your notification of how they can get a copy of their records. You can provide an alternate phone number, you could provide um, anything, an email address, even, um, as long as there's some way that they can contact the practice for medical records purposes. If our medical records reside on the cloud through an EMR company, would the records custodian be required to continue to maintain the records, pay fees to the EMR and pay fees to the EMR company?
Oh, I mean, if that's where the records are being stored and that's what the EMR is requiring, if they're requiring fees to maintain that data, if it's nowhere else, that's going to be something that you would need to uh, coordinate with your EMR provider. You will need to have access to the records in some form to be able to provide them and meet the rules of retention that the TMB has.
Yeah, I think that that's something you're going to need to have a conversation with your EMR company about. They should be able to provide you your records in a flat file, like in a PDF copy, because you aren't going to need, or nor will the custodian of the records need, the functionality of the EMR. They're just going to need basically the closed record. So I would have a conversation with the EMR company to find out how they can provide you those documents so that there is not going to be that ongoing maintenance fee. Now, of course, I would almost imagine the EMR company is going to tell you there's not a way to do that, but um, there should be. So, if you have if you have any further questions on that, you can email us at cyber@tmlt.org, and we'll have more conversation with you about that. Am I required to transfer the records if I have not seen the patient for more than 2 years?
For if outside of a notification, the notification is for patients that you've seen within the past 2 years. But I would recommend that if you get a request for medical records, because of the rules that the TMB has for retention, adults 7 years, minors 21 years or 7 years after their last treatment, and deceased, that it would be beneficial to go ahead and send those if they're being requested in an appropriate manner per HIPAA guidelines.
Yeah, I think that is correct. And obviously, some specialties that becomes much more important than others. But yes, you still have to meet the TMB requirements. If I'm retiring completely and do none of these things, what can the TMB do?
Uh, Kathy, you can speak to this too. My understanding is that they can enforce financial fines. That's one of the things that they can do. Obviously, review. If you're completely retired, the review may not be meaningful, but the financial fines may be something to take note of.
I agree. And if there was ever a situation that you wanted to go back into practice um, in any capacity, there may be some issues. So it's always best to try to comply with the rules. I'm sorry. For a patient seen in the hospital in consultation, and for the example, the patient was the care only lasted 3 to 5 days. Is that situation excluded
This is a
in the
reminder. Go
requirements?
drink water. This is a reminder. Go drink water.
So for this situation, uh, if the care took place in the hospital solely, then that is an exception to patient notification. However, if the patient was seen in those 3 to 5 days in follow-up care in an office in your office setting, then the notification would apply to them since they were seen in the office setting. That would be my recommendation. But if it's only within the hospital, then there is that exception.
Medical records typically are in an EMR, EHR. How about other systems, your billing systems? Is there the same retention requirement?
Yes, per the form or the format, either paper or electronic, the retention requirements are the same.
And one of the other things you may want to consider is HMO billing contracts may require that you keep billing records. There are some Medicare contracts that require that you keep your billing records for 10 years. And so that would be both the billing side as well as the patient care side. Does using a resource such as Constant Contact qualify for notifying the patients by email?
Yeah, as we mentioned before, email is not something that we would recommend from a HIPAA perspective unless it's requested by the patient for notification, in addition to not meeting the TMB rules.
If you're leaving your employer and there's a 2-month window between your leaving and your new practice startup, who's responsible for those patients in that window? Medication refills, such as that, uh, and and obviously they're concerned about being charged with patient abandonment.
Yeah, and the continuity of care is critical for these types of situations. I think this is something that you would want to have develop a plan with the practice that you're leaving. Same with diagnostics, anything that's coming in that may not come in the time frame or a refill that is beyond your window is having a plan that you've agreed to with the practice that you're going to be departing from.
Um, there's a question, and I'm not sure this is something we can really address, but if a physician is terminated without cause, effective immediately with no notice to the patient, um, what do they need to do?
I think that the is do the best you can to meet the the requirements of. I know it may be hard, but I would try to work with the practice and ask them to be able to post a notice, even though you've already been terminated, but just some kind of notice postings, and having that list so that because it is your responsibility to make that notification, and just asking them to work with you to get the information that is needed for you to meet these TMB requirements.
Must an electronic medical record provider provide records on their system if a patient requests? Is that the default custodian? And my thought is that number one, that's probably addressed in um, your question. I'm sorry, your contract with the EHR vendor, but typically they are not the custodian of the medical records. I am closing my private practice and will be doing telemedicine several times a week. I am moving to a different state and will do telemedicine in Texas. Do I need to have an address in Texas? Do I use my address where I relocate or the address on the telemedicine platform as the physical address?
This would be a telemedicine rule that I would refer to the telemedicine guidelines to get a clear answer. it's just so that we're not leading you astray. Kathy, feel free to add if you have a better guidance there.
I agree. The TMB has quite extensive guidance on telemedicine now on their website. And so, again, that'd be a really good place to actually go to do that research. If you're if you still have questions, again, you can reach back out to us, um, or certainly you could involve a an attorney to help you sort that out. Um, Question is, the TMB has allowed use of the patient's email address to inform them with their specific approval. I placed that at the end of the patient's demographic form, and most patients complete that area giving approval. This is kind of a tricky one from a HIPAA standpoint, in that the HIPAA interpretation currently is that the patient needs to request that you use email to communicate with them. And placing it on your form is really not going to meet that requirement. Um, so technically, yes, you have those in your possession. I think you probably could use those, but if you're going to be continuing your practice, you may want to look at the wording and maybe make it, um, let us know if you want email communications or something like that on your form rather than just asking for their email address. Do you have any other thoughts on that, Cassie?
No, I agree. It gets tricky from the HIPAA perspective of the patient should be the one to initiate the request for email. I know we see this on forms often in offices where it has a place for their email opt-in, opt-out. But re from the perspective of the OCR, Kathy, I feel like they want the patient to really initiate that request for email communication.
A physician asks that they are retiring from a large group practice with an internet based EHR, which will continue unchanged after they depart. What do I need to do about medical records?
So, yeah, again, it will be developing a plan of who is the custodian or storage and retrieval and how you're going to be able to access those records to provide them to the patients when they request them. So you'll want to navigate that with the practice or the group or directly with the EHR. It could be an option as well.
Yeah, I think that's an excellent uh, point, but hopefully the group will be the custodian of the records for you in that situation. Physician says they have personally handed every patient seen in the last year information on the practice closure as well as medical records release forms. We kept a copy in the chart. Do we have to mail something to them as well?
I think we alluded to this a bit earlier. If you have a record that of all of the ones that you gave the paper form to, that 2-year window of patients seen would still need to be addressed. So you want to reconcile which ones you were giving the paper copy in the office, and those that did not receive something in writing would need to receive something in writing regarding the closure.
Right, because the requirement is that you send a letter. So instead of sending it by USPS, you physically hand it to them, I think meets the requirement. It's just, what other patients have you not seen? How soon do we have to start notification? Um, each part, public, office, and email. So, or, or mail. Typically, it's within 30 days you have to post the notice, you have to notify the board. And I would say that, you know, at least 30, if you know you're retiring or changing locations, 30 days prior to that change um, is actually a good amount of time. I know that I discussed with a practice a couple of months ago, the physician notified or sent out the 30-day notice, but then they actually only worked 1 day a week. So patients were calling in trying to see the physician before they left the practice, and it was creating quite unhappy patients that they couldn't get in to see the physician one last time. So 30 days would be, I would think, the minimum. See, we only have a couple of more minutes. Um, let's see, there's a rephrasing. Is notification to the patient required if the physician leaves a group, but there are still physicians within the group that will be seeing the patient? The answer is yes. The physician is still required to notify the patients that they were leaving the group. I'm currently in a group who manages my records. If I retire and or move to another state, do I have individual responsibilities to provide the notifications? How about if the records are all electronic? Again, the requirement is on the physician, not on the practice, to notify patients. Um, Both the public notification, the in-office notification, and the notification to the patient that you are leaving the practice. So if a physician is leaving a clinic location, starting employment at a hospital in the same city, should this information be given to the patients at the closing of the clinic location?
I'm guessing this is referring to the written form that they're giving to them.
I think I would take that do they have to notify where the physician is going if it's to a hospital?
I mean, there's no requirement unless the patient asks where the physician is going, and in that case, the group would want to let them know where they're relocating to.
Right. Uh, there's a interesting question about what if if the physician uh, becomes disabled or if they died while practicing, are the rules different? Um, Obviously, you can't do the 30 days notice prior to death or disability because obviously you can't predict that. But as to my knowledge, all the rest of the rules are required. You still have to notify, and unfortunately, that is a difficult situation. But unfortunately, that is one that a number of practices have had to deal with. If another doctor takes my records, can I require him or her to send these letters and be the custodian of the records?
This is one of those scenarios where you would want to know what the contract said initially. I think at the beginning of employment, again, it is the responsibility of the departing physician to make arrangements for a custodian and to send those letters. Can it be done? Yes, but I don't know that you can impose it upon another physician if they're taking over your patient load, but might be worth consulting an attorney just to make sure that you have everything in line with that scenario and nothing was missed from a initial employment contract.
Clearly, we had anticipated that there would be a lot of questions. Um, Unfortunately, it looks to me like there's about 10 or 15 more questions that we're not going to have time to get to. If they are something that you can't find either in the presentation materials or the rules that we've provided, I would encourage you to use the cyber@tmlt.org as an email that you can email us. And just one last HIPAA requirement. If you had a breach of medical records affecting fewer than 500 individuals in 2022, you have until March 1st to actually notify the federal government um, at the OCR of that individual breach or that smaller breach. So if you have questions about that as well, we did want to remind you because that date sneaks up on everyone. Uh, if you have if you have questions, again, cyber@tmlt.org is an email that we'll certainly reach out to. Cassie, any closing thoughts?
No, we just thank you guys for your time today. Thank you for participating and submitting all your questions. As Kathy mentioned, we're sorry we couldn't get to all of them, but feel free to reach out to us if you still need some clarity on something. We know your time is valuable, so thanks for spending a little bit of your day with us.
Thanks again, everyone, and be safe, and we'll hopefully see everyone again in February.